Good afternoon to one and all. Today, we are here for a webinar on the basics of aquatic therapy, and this webinar is conducted and organized by IAP Women's Cell Ghaziabad team. Also, I would like to welcome our resource person for today, Dr. M. Theepak sir, who is MPT, PGDA, and DPHA, and also a certified dry needler, aquatherapist, fitness instructor, and member of ATNI. We welcome you, sir. Today, as the moderator, we have with us Dr. Monica Chandra ma'am as district coordinator from IAPWC Ghaziabad team, Dr. Priyanka Tyagi as sub-coordinator, and Dr. Abhivyakti Navgeet as sub-coordinator. We welcome you all. I, Dr. Neha Singh Mandade, welcome all the participants and the attendees for today's webinar session. And I, on regards of the digital team of IAP, technical team, I would request all of you to keep sending your questions, if any, in the chat box, which will be taken up towards the end of the session. Now, I would like to hand over for the further proceedings of the lecture for today's moderator, Dr. Abhivyakti ma'am. Ma'am, over to you.
Thank you, Dr. Neha. Thank you for the warm welcome. A very good afternoon to all the attendees today. So our topic for the webinar today is the basics of aquatic therapy. So we all know what role aquatic therapy plays in the rehabilitation for different kind of patients, different kind of conditions. So this is a very vast topic. So we had a discussion with Sir, and he said that we'll be covering all the basics in the first module. We are trying to convert this webinar into a 3-series webinar. So the first module will be describing the basics, and in second module we'll be describing the techniques of aquatic therapy, and the third module we would be taking all the conditions and what all can the exercises done in those conditions, specific conditions regarding physiotherapy. We have been working on this, so we will be deciding on the dates. And now I welcome you, Dr. Theepak sir. He was, hello sir. It's a great honor to share the platform with you. And because all the participants, I have been studied under sir. He was the vice principal when I was in college. It's a 19-year-long profile for sir. Sir started his career as an assistant professor in Dharmanthaka, the Malingam Institute of Paramedical Sciences, Tamil Nadu. Then he was in Sri Devi College of Physiotherapy. He was our vice principal in Acharya College of Health Sciences, Bangalore. And he also was a principal and HOD in K. Pandyaraj Balal College of Physiotherapy, Bangalore. It has been an incredible journey for Sir. He has presented so many seminars. He has taken a lot of seminars and international conferences, and he has been awarded a lot many prizes in those. And he has been a speaker for so many webinars, and of course the seminars also. So it's a great honor for us that you are taking this webinar for us. So over to you, sir. Thank you.
Thank you very much, Abhigti. Actually, we call her as a Sargam. Okay.
Yes, sir.
Yeah. Okay. Okay. It's a very good interaction. I really appreciate, and I don't know whether this much I hold. Okay. It's anyway.
No,
it's good.
Definitely.
Okay. Okay. Thank you, and welcome participants. It's a warm good afternoon to everyone. It's a very nice topic, and it's a very huge topic also to cover with. But before going to the applications and techniques, first of all, we should know that what is aquatic therapy, how it works, and we might have studied that in our UGs or PGs, but still, it has a lot of variance in applications. So theory is different and it's practically is totally different. So we all will go through that, and I'll show what all the facilities I have and what all the problems I suffered during building a pool, and how I progressed from that. So meanwhile, on the way of our webinar, I'll explain what all things I have experienced. Okay, can we start now?
Yes, sir, please.
Yeah, okay. Just a minute, I'll share my screen. Okay, it's visible.
Yes, sir.
Okay. So today's topic is on aquatic therapy. It's module one. So in module one, what are things we are going to cover is the definition and what are the basic principles, what are the goals we have to follow in aquatic therapy, and what are the designs of the pool and how the pool has to be constructed, and what are the things required to have a therapeutic pool. That's what things we are going to cover today. And on the next topic, we'll be covering what are the techniques we use. In this, I'll give an outline of the techniques, but the next one, I'll exactly tell what are the techniques we follow in aquatics, as well as how the patients can be implemented according to the techniques. So that will be the second module. And third will be depending upon the conditions, which conditions, what can be done. So, okay. So these are the things we are going to cover. So first one is this module one is basics of aquatic therapy. So this is my profile, and in my clinic, I mostly follow manipulative therapy only, chiropractic, Varma is the main thing I follow now. Than using our physiotherapy modalities. And for rehabilitation and pain, I take to aquatherapy, especially even for back pain or knee pain, I take to my pool. That gives a greater results than our landscapes treatments. Okay. So from 2012, I am running the clinic, and the present clinic is like 5,000 square feet. It's a physio hospital. We can name it as physio hospital. Only physiotherapy we do in this much big building. So this is my clinical setup. So here we conduct aqua fitness also. There are some 3 batches is going on for aqua fitness. There we go for aqua aerobics, and other than that, we go for a treatment of the patients from pediatric to the geriatrics. OP setup is there in the ground floor, and first floor I have my pool, and the other side I have my fitness center also. So this is the setup. This is my pool. Okay, this is 22 by 12 and a half is the size of my pool, and the depth is 3.5 to 4.5 meters depth. Sorry, feet depth. So these are the structure, and this is the manual pulley, actually like a crane to shift the patients from land to the pool. So these are the things I have now, and so many properties do I have. I'll explain what all things I have in the later stages. Okay, first, what are the key concept of aquatic therapy? First is we'll know the definitions. Okay, so definition is like aquatic therapy refers to the treatment and exercise performed in water. Just a minute. My other screen is not okay. Okay. Aquatic therapy refers to the treatment and exercises performed in water for relaxation, fitness, physical rehabilitation, and other therapeutic benefits. For relaxation and fitness, it's a separate topic, and mainly our physical rehabilitation we'll go through what all things are there. But aquatic therapy plays a very good role in relaxation and fitness too. Okay. Treatment and exercise are performed by floating, partially submerged, or fully submerged in water. It is performed in the specialized temperature control pool. My pool is an temperature controlled pool. I can vary the temperature from till 60 degrees centigrade. So I have a separate heat pump for that. I heat the whole pool. So it varies it varies according to the conditions what I treat. Okay, so temperature control is very important. Otherwise, it's very difficult to handle the patient in all the climates. So the first thing I faced is like temperature control is very much important to maintain aquatic therapy pool, mainly for the rehabilitation purpose. Okay, what are the purpose? Facilitate functional recovery by providing an environment that augments a patient's ability to perform various therapeutic techniques. So, as we know, it's like than going for exact particular techniques. It's all like imagination and our discovery. What all things can be done? It's applicable for each and every our own skill. By our skill, we can do what all the things we come across, or what all things we plan, it can be executed in the pool. That much friendly the pool will be. Okay, what are the goals for aquatic therapy. First is range of motion exercises, resistance training, weight bearing activities, delivery manual techniques, access to the patients, cardiovascular exercises, functional activity and replications, minimize risk of injury and re-injuries or relaxations. Okay, so first we'll come to ROM exercises. In our physiotherapy role, range of motion exercise is the very foremost important things we come across. So range of motion is very easily achievable in underwater, and I'll say how it is going to happen in later stages. Okay, so to go for a range of motion or to increase our range of motion, water helps. We know that water assists as well as resist, so it influences the range. Whatever we plan, it helps us to do the range of motions. And resistance training, if you increase our load or decrease our load, or if you give some additional weights to the patients or additional force to the water, it acts as a resistance training. So weight bearing activities, and here is the main principle of water. How much weight we should calculate for the patient, or how much weight has to be given to each conditions, or how much water level should be there to increase the weight or decrease the weight of the body. So that all things we will deal. And this weight bearing activities and weight bearing of the patients or level of water plays a very important role in aquatherapy. Delivering manual techniques. See, all the techniques, for example, joint mobilization or stretching, or any what do you call it as jumping activities, proprioceptions, everything can be delivered in our everything can be delivered in water. Access to the patients. This point says that the patient, those who cannot do anything in the land, they can do in the water. For example, if a hemiplegic patient cannot walk properly, they're not even cannot walk a single step in the land, can walk inside the water. That's the main and foremost confidence it gains, so that the patients feel very happy, and he will be interested in doing, because no, his functional activity is gained, so that the patient always feel that aquatherapy or treatment underwater is more helpful and more enjoyable also. Then will come for the cardiovascular exercises. So it plays a very important role in fitness also. Increase the resistance or increase the workout, automatically our cardiovascular system starts working, so that when the heart rate increases, our cardiovascular system starts. So that will discuss later. Functional activity replications. So what are things mainly I told, no? If a patient comes with hemiplegia or cannot be able to walk, he can walk. At the same time, the third day after ACL injury, or the patient, even bedridden patients, if cannot be able to move, even that patients can be kept under the pool. So with some conditions. Okay, so anything is possible in water. That's what the main concept of aquatherapy. Then minimize risk, and we don't have a fear of fall. That's the main thing. Once the patient get confident and we exactly tell what is the orientation, what is the principles we have to follow underwater, and the patient gets confidence, surely he will not fall down. And if at all it happens, there will not be any injury to the patient, unless then there is some other problems are there that we will discuss. And relaxation, what are the relaxation can be done? We know that if we just lie down in water, we are just relaxed, our body relaxes. Like that, so many techniques are there. Mainly Watsu technique helps for relaxation, as well as so many soothing techniques are there, like Aichi techniques is there. So this all helps in relaxation. So these are the main goals which we are going to follow in aquatic therapy. Then comes the principles and properties of water. So these are the main principles. We might have studied that what is buoyancy, what is hydrostatic pressure, what is viscosity, thermodynamics, and all. So once again, I'll have a recap. What is buoyancy, viscosity, thermodynamics, hydrostatic pressure, and flow. Okay. First, we'll come to hydrostatic pressure. It's a Pascal's law states that fluid pressure is exerted equally at any level in a horizontal direction. That is, pressure is equal at constant depth. An immersed body does have a fluid pressure exerted on all the surfaces when at rest at the given depth. Here it comes to main important role. So when anything is submerged inside water, the pressure equally exert on the object which is immersed. That's the meaning of this. And if the depth depth is increased and the pressure is also increased. It means that if the depth of the pool is very high and the pressure to the body or the pressure to the immersed object is also very high. So the pressure is equally distributed according to the depth, according to the weight of the person, so that the body is maintained centered and the pressure is maintained in all the direction towards the body. Then comes the viscosity. Viscosity plays one more special role. Water viscosity creates resistance in all activity movement. We know that water resists and assists. So we are in contact with the water. So one side it assists, one side it resists. So whenever you want to move, there is a resistance. A shorter lever arm results in increased resistance. In the other hand, in land side, we used to say if the lever arm is longer and our weight is at the what is that, at the end range or at the distal point, the resistance is more we feel. But in water it's different. The shorter lever arm results in increased resistance because the patient has to put more weight to produce the movement, because when you submerge inside the water, the body weight comes low. For example, if he is submerged up to the level of his shoulder, the body weight decreases to 75%, so that the effort is very less, but the muscle has to work more to overcome the resistance. That was the shorter lever arm results in increased resistance. During manual resistance exercises, stabilizing an extremity proximally requires the patient to perform more work. For example, when you want to give a resistance exercise, for example, you want to give an abduction in standing position, when you got to give abduction. So what happens is, during manual resistance exercise, stabilizing extremity proximal require more uh, proximal require the patient to perform more. For example, we call it abduction. So when you give resistance near the head of the humerus or at the biceps to do an abduction, what happens is he has to work more. Rather, if you give a resistance at your hand, the workload is very, very, very less. The patient can move easily. Okay, the next point is increase the surface area. Moving through water increases resistance. Again, how much deep you go, how much fast you move, the water resistance, the resistance increases, so that the patient or a person has to put more effort to produce a movement. Okay. It's clear? Someone can answer?
So it's
Yes,
clear.
sir.
Okay. Okay. Then main thing is surface tension. Surface tension is a phenomena in which the surface of a liquid, where the liquid is in a constant contact with the gas, acts as a thin elastic sheet. This term is typically used only when the liquid surface in contact with the gas. I'll tell what is that. Such as if the surface is between two liquids, such as water and oil, it's called as a interface tension. An extremity that moves through the surface performs more work than if kept underwater. This is like, see, you can think that you are kept your arm just above the water level, just your fingers are just touching the water level, and if you move, the movement is very smooth and movement is very free. At the same thing, if you just dip inside the water and you try to move, the movement becomes very strong, as well as the movement requires more effort to be performed. That's what the surface tension plays the role. So how much we are near to the water than the depth, how much we are floating or how much we are at the level of water level, the movement is very high and it is easy to move also. And how much depth we go, it's very difficult to move. So this is the best example. An insect sits on the water, the bees or the legs just touching the water level, and it moves very fastly. The same legs, if it goes down, the insect cannot move faster as it was like before, that is touching the level of the water. So the same principle works for all the movements also. This is the main point. Understood? Okay.
Yes, sir.
Yeah, okay. Then is the drag principle. So drag is the cumulative efforts of turbulence and fluid viscosity acting on an object in motion. See, for example, if you want to swim or if you want to move, there should be some force, there should be some effort, there should be some movement. All this is called as a drag. How much we pull, that much we move. Okay, that's the meaning of this. As the speed of the movement through water increases, resistance to motion increases. See, for example, if you want to run or if you want to swim faster, So what happens? The resistance to the body and the water places a more resistance because you want to move faster. So as the speed of the movement through water increases, resistance to motion also increases. So we consider now, we take an example for a patient. If you want to give a patient an equilibrium reactions, or if you want to make the patient for a balance reactions, he can stand. If you want to give the next level of standing balance, what we have to do is like increase the water flow. Increase the water flow in the sense, give the direction of the water flow or a speeder water flow. Automatically the patient tends to move and he has to control the movement. That's what his balance will be increasing. So moving water fast to the patient require patient to work harder to maintain his or her position in pool. And maintaining the equilibrium state in the water is always very, very important. We says that whenever you go to the water or whenever you are in the pool, you have to stand. You have to stand in the same place where you stand whenever you do workout, or even when you go for a motion, because that gives more stability and your muscle work is more when you stand. Then applications of equipments. What are the equipments or what are the accessories required? Because so many things are there, like noodles, gloves, pedals, boots, and floaters. So many things are there. We'll see what are the basic things we need. Okay. Now here comes the what is the drag while swimming. So while swimming or in the pool, we need to wear a jersey, nylon, or a swimsuit. Why it is so? Because if you wear other clothes, for example, a cotton or other clothes, what happens? It produces more resistance and the friction increases, so that it needs more effort for you to pull that. So the exact dress materials, mainly nylon or an jersey, will help you to do that. And what happens is that too will reduce the surface tension, and that too will reduce the friction, and so that your body weight is stagnant as before, rather than you wearing a cotton shirts or that. Okay, what is the drag effect? See, for example, see this first diagram. This is the buoyancy effect. When you try to lie down on the water, the buoyancy, that is the COG, falls exactly at the sternum weight, and the buoyancy is which pulls up, and the thrust is the forward, and the drag, what we are going to do, which movements we are going to do, is the drag movement. So here you see, when you want to move in a constant and mild, or like a constant speed and constant movement, the drag will be same with the same force. When you want to increase the force, you have to go little deeper, and you have to give a effort, so that the surface tension increases, your body effort increases, and the resistance increased neither to the body nor to the water, and so that you get the more speed. So the drag plays a very important role to increase your speed, or to increase your movement, or to decrease your movement. It depends upon what requirement we need now. Now comes the center of buoyancy. In a vertical position, the human center is located at the sternum. During unilateral manual resistance exercises, the patient revolves around the participants in a circular manner. For example, you imagine that a patient lies supine, and you have to give an abduction of the right leg, for example. So you have to ask the patient to do an resistance training for the abduction of the right leg. So when you give a resistance to the abduction, what happens is the patient tends to move the which side the resistance is given. So that's what the buoyancy places the center of the sternum, and it makes the patient to revolve around that. So our principle, our main idea is to, we have to hold the patient, or we have to support the patient such a way that the body which we want to move, that alone has to be moved. So the center of buoyancy, it plays this important role in that. We'll see what is center of buoyancy. Okay, we know this. If the weight of the object is very high, the body sinks inside. If the weight of the body and the water level, what the weight of the water is equal, then the body tends to float. So this means that how much is submerged inside, that according to the weight of the object immersed, the water comes out. That's called the buoyancy. We all know that that's called the positive buoyancy. If the weight is very less, or if the weight is dissolvable, it goes down, and it will not be able to have a constant equilibrium, is cannot be maintained. So these three things we all be knowing. Here I want to tell you one thing. It always depend upon the body mass and the volume. For example, if a patient is a very good, have a very good bone strength or bone mass and the body mass, automatically it says that the weight is high. surely he will be going down, because no, the body mass is very high, the weight is high. He'll be just immersed inside the water according to the body level. At the same time, if the volume is, he may be fat also, he is not a very big mass weight or a bone weight, he will be floating in the water because the body mass is not there and the bone weight is not there. So it says that that's the meaning, that the child will float, the geriatric persons will float, as compared to other adults. The child will never drown, and a patient with a heavy volume will never drown in the water. And the other hand also, no one will drown in the water unless then your cardiovascular fitness and respiratory fitness is sufficient. If you have that, you cannot drown inside the water. I'll tell how it is. Okay, so this one, you think of positive buoyancy. If you try to sit inside the water, whether it's possible to sit, it's not at all possible. So it means that according to your body weight, you will be floating somewhere else, unless then you have a breath control. How much stamina or how much your respiratory muscles work or how much your respiratory capacity is there, according to that you will be floating in the water. You will not be submerged inside, unless then it happens, unless then you drink water. Okay, so buoyancy plays a very important role in our physical therapy. So this is the thing. Center of gravity plays there near the sternum. It depends upon the body weight and how much. If you put your hands forward, the center of gravity changes. If you put your hands back and you just lie down, your center of gravity plays at the center, and the buoyancy force exactly opposite it falls. And the level between your body submerged and the body is up, some water will be spilled out. That is called as a buoyancy. That's called as a Archimedes principle. So how much the weight is submerged inside the water, the amount of water which is exerted out is equal to the amount of body submerged inside the water. So these are the three things we will be having, we will be experiencing inside the water. So what are the advantages and what are the disadvantages we have in therapeutic aqua therapy? First is advantages: buoyancy, weightlessness and joint unloading increase active movements. Because as I told that whenever we go inside the water, our body weights decreases. It depends upon the level of the water, that you will see later. So usually the body becomes light, we can move easily. Then hydrostatic pressure reduces or limit efficiency, assist various venous returns, induces bradycardia, and centralizes peripheral blood flow. Because there is an exerted pressure all over the body, it creates an internal pressure, and it reduces the efficiency. And the venous return is equal, because how much the body is immersed, that much pressure it exerted. So the venous return plays an important role neutrally to all the areas, and centralizing the peripheral blood flow, because the heart has to pump equally to all the areas. So the heart has to pump the blood to all the areas equally. Then viscosity, resistance with all the activity. How much resistance we need, how much activity we need, depending upon that, we can vary the water level, we can vary the body weight, we can vary the resistance also. So viscosity plays the very important role. Then turbulence. If you want to increase the effort, if you want to increase the muscle power, and you can alter the turbulence, or you can alter the force of the water, or you can alter the depth of the water, so that the muscle effort, muscle tone, or a muscle power increases accordingly to the turbulence also. So it gives a tactile sensory stimulus, reduces stress, reduces pain to the greater extent. Because we are in the water, automatically it gives one sensation. We know that whenever we go into the water, we feel happy. So that sensation will reduces stress, reduces the pain to such extent that you will be floating, your body weight is reduced, so that the pressure which we have, that intensity of pain which you have, will be reduced automatically. So these are the advantages we get. Apart from this, there are so many advantages. These are the basic advantages we are going to be facing in aquatic therapy. And the disadvantages, there are so many disadvantages too. But the first and foremost is the cost of building and maintaining a rehabilitation pool. It plays a major role in maintaining a own pool, because constructing a pool is not as easy. A lot of problems are there, and I would like to share my experiences, because my pool started leaking after my opening, after opening the pool, maybe approximately after 1 week after my opening, because somewhere the leak happened. I don't know where it was happened, and it took a lot of pressure, and it took a lot of time. Nearly it took 4 months to heal that. We tried to close here and there, but it's not possible. So we broke everything inside, and once again we rebuilt the pool. So my pool is in the first floor, so I had a lot of problems. I faced so many things. But now I am very clear with what has to be done, what has to not to be done, and how it has to be built. Even though your architect or your engineers perform, there are a lot of things has to be considered also. Then specified personnel. Therapists must be trained in aquatic safety and therapy procedure, because just like that we cannot get inside the water, because handling is very, very important, and the instruction what we give, and how we handle the different type of patients, kids, heavy patient, volume patient, and geriatric patients, or some patients like who are semi-conscious, or some patients who are really disabled. So each and everybody has different functions to be played inside the water. So you should be very, very specific what you are going to do, what instructions you give to the persons, and how we are going to make the patients to get in and get out of the pool. It's a very challenging job we face day by day. Then thermoregulation. Depending upon the conditions, we have to change the temperature also. At the same time, our body has to accommodate the temperature what we want to be having. For example, if it is a winter season, if the pool is below 20 degrees, or if the pool is below 26 degrees centigrades, it's highly difficult for a person, even for us. It's highly difficult to stand for quite some time, so that your muscle gets sore, and you'll not be having power to do that. So thermoregulation is very, very important. How much has to be given, and what is your heart volume, what is your heart rate, what is the maximum heart level you have to maintain. Everything has to be calculated before, and then only you have to make the patients to get inside the water. So these are the main advantages and disadvantages we face. So here comes the very, very, very important things: body weight percentage. How much we should submerge the person inside the water. Okay. So for example, if you want to give less load to the person, for example, if he is you have it as a osteoarthritis of a bilateral knee, so the load of the knee has to be increased. Whether you want a 50% load or 75%, you have to decide. If you want to have a 75% load, that is 75% less load, then the patient has to be in the deeper side. That is, the water level should be up to the nipple level, so that the body weight will be lesser. So 75% body weight will be lesser to the patient, so that the load to the joints is reduced. At the same time, if you want to increase the load, you have to reduce the water level. So this diagram shows how much the water, our body weight reduces when you are immersed inside the water. So, and one more thing I have to tell: if the body is immersed fully, or if the body is immersed up to the neck level, your muscle work has to be more, because your body is floating. So to maintain the equilibrium, at the same time maintaining the force is also very, very important. So this plays very important role by maintaining the water level, and by calculating what we need, and what type of pressure you need, what type of exercise you are going to give, and which joint has to be loaded, and in how much force that joint has to be loaded. You have to calculate before you enter inside the pool. And for example, if you take athlete, uh, for example, take it as a runner. So the runner has to have a very good speed. For example, the stride and the speed, you calculate like that. You want to increase his stride, or you have to increase his speed. So what you have to do, first thing is whether the patient can move fast. So you make it to the 50% of the body level. For example, up to the hip level, you ask him to run, or you have to ask him to do how much time, what is the distance he covers. Then reduce the level of the water, that is, make it as 35% below the hip level. And you see, because no, the water level reduces, the body weight increases. So it gives various calculation. If you want to increase his performance still higher, if you want to increase his muscle work, then put him under the water. You ask him to submerge inside the water. So here what happens is, his cardiovascular should work, his respiratory system should work, He has to maintain equilibrium. He has to maintain his stability. At the same time, he has to give a performance also. Here, the muscle has to work also. So the effort is to be the 100, not even 100, but it should be 200% to overcome this 50% of the body weight. So by this calculation, we will come to conclusion that if you want to increase the muscle power, or if you want to increase the endurance, or if you want to increase um, uh, the capacity, so we have to make the patients to go down, or we have the patient to immerse fully. On the other hand, if the patient comes, or if you want to increase the joints, particular joints load, or if you want to decrease the particular joints load, or if you want to facilitate a particular movements, then this calculation has to be made accordingly. By this, we can modify the person position also. We can modify the person's activities also. So everything is possible. Only thing is we should know what we are going to do. Okay. Then comes the mobility. So buoyant equipment may assist the movement initially. Warm temperature may increase soft tissue extensibility. Stretch technique can be used in two ways, active and passive. So as I told, no, everything is possible inside the water. You need not to worry. Everything is possible. Whatever you want to do, that's what I know. Muscle range, muscle work, muscle effort, resistance training. Simply to say, what are the things you do in gym with weights, curves, and weights? Everything is possible inside the water without any weights. That's what I tell. Without any other weights which you use in the gyms, that is possible inside the water. Then trunk stabilization. Here, as soon as we enter inside the water, stabilization is the first most thing. If your trunk and your core is not stable, you cannot stand inside the water. So first things, whatever the activity you do, your core will be automatically come into contact. Without the core, you cannot do anything else. When you want to give an any movement in any plane, you take it as a vertical, sagittal, whatever the plane you want to do, your core has to be as powerful as how much action you are going to perform. For example, if you want to jump, without the core you cannot jump. If you want to run, without the core you cannot run. You might have experienced, some people might have in the pool, if you try to walk or if you try to jump, you tend to fall down. It means that you didn't contract your core, you didn't keep your lower torso very stiff. That's what it happens. So what happens is, as soon as you go deeper inside the water, your core has to be more tightened, your core has to be well maintained, your trunk has to be in an stiff manner, so that you can maintain all the motions and you can perform all the activities. So many positions are there. That's what I don't know. Everything is possible inside the pool. You cannot mention like walking, marching, jumping, high jumping. It's not like that. Anything is possible. We can do all the activity: open chain, closed chain, resistance training, whatever is there. Underwater treadmills, underwater running, underwater sitting. So many things can be done. That's what we cannot deny that this is not possible inside the water. So everything is possible. So how to start with? Beginning aquatic rehabilitation as early as possible after the injury to minimize the effect of immobilization. That's what it will know. In ACL patient, what I do is like as soon as the sutures are removed, my surgeon says that maybe after 7th day, before 7th day, we may bring up to 60 to 70 degrees of knee flexion in ACL conditions. Immediately we will make the patient to put inside we'll put the patient inside the water. So what happens is like the muscle power increases and his efficient decreases and the range of motion increases without any pain. The patient will not have that much difficulty what we mobilize outside in water, because no, we know that in ACL we put an CPM, we tend to move, patient's pain is very high, but that things doesn't happen inside the water. So he easily performs the activity, and the range of motion increases drastically. I have treated a person with ACL. He was around 19 years old. Within 1.5 months, he started jumping in the land. He started climbing stairs. He started climbing unilateral leg bearing. So that much is possible in aquatic rehabilitation. So where to start with? Start with walking and we make it till jumping. So that much is possible inside the water. So we have to start with water. Before going to water, there are some techniques which has to be followed. I'll let you know afterwards. Okay, design, what all things can be done? Depends on the injury, depends on surgery, treatment protocols, results, and what you want. That's what I told you. Everything is possible. First thing is our plan and how we are going to execute and what are the techniques we are going to follow and what is going to be outcome. We can see in our eyes, this patient is like this. For example, take a OA. OA patient is like this. He used to limp, or he may not be flexing his knee while walking, but the same thing is reversible inside the water. He will not limp, he will flex his knee, he will go smoothly, the confidence increases very high. So that gives more confidence. By increasing the power and by increasing the resistance, we can gain more power to the patients immediately after few days. So we have to plan accordingly what has to be done, which muscle has to be facilitated, or which joint has to be loaded. So everything has to be pre-planned. Exercise technique. The four variable can be manipulated by altering resistance assistance: position, direction of movement in water, water depth, as I told you, lever arm length, use of flotation on weighted equipment. That's what I told you. Anything is possible. We can change all the direction. If you want to turn to the right, it's possible. If you want to turn to the left, it is possible. In this, we'll come to state that you may be wondering how the ship stands, or how the ship floats in the water, typically as a buoyancy effect. At the same time, how it turns, that's called a metacentric effect. And for a human, we say that we are, you imagine that we are lying on the water. If you want to turn to the right side, you cannot just turn your full body, you will be submerged inside. So what happens is, just turn your head to the right side, hold for 3 seconds to the metacentric effects to be played. You don't want to move anything, automatically your body will move. And if you want to come to neutral position, you turn to your head to the neutral position. It is in lying. If you want to lying to stand, or lying or stand to lying, okay, so just lean backward, take your head towards the ceiling, automatically your lower body will come up to the floor, come up to the water level. So this is mainly by the COG, mainly by the buoyancy, as well as by the metacentric effect. So any position the patient can do, any position we can alter, any joints can be loaded and unloaded, and any pressure can be exerted, or any pressure can be increased or decreased, any length, any lever arm, any resistance can be given. So like that it goes. So generally speaking, nothing is impossible underwater. So here comes temperature regulation. So maintain between 26 degrees to 33 degrees for mobility exercises. So below 26, it's not possible to withstand, because water will be cold. Our venous return plays a lot of variations. We get shivering, we get cramps. So many things takes place. Our body temperature should be, our pool temperature should be 26 to 33. But in my pool, I bring up to 35 degrees to, if I take a pediatric cases, mainly CP, autism, or any other cases, I bring the temperature to 35 degrees too. And if hemiplegic and other things, it's okay. But for an athletes, I bring below 26 degrees, because with that temperature, they have to perform. Their muscle execution should be very high. Their respiratory level has to be increased. So I bring the temperature below 26 degrees. So patients are unable to maintain adequate core warmth during immersed exercise at temperature less than 25 degrees. Okay, patients very difficult. At least 30 to 35, it's possible. Below that, patients feel very shivering, and cramps will take place. Hot water immersion more than 37 degrees may increase the cardiovascular demands as rest and with the exercises. Again, in hot water also, we cannot perform any aqua aerobic exercises or any high intensity exercises. So it gives more demand. So it's not possible. So ideal temperature is we maintain between 30 to 35 degree in South Indian conditions. I'm dealing about South India, mainly Tamil Nadu and Karnataka. In North, it may vary also, because, and one more thing, the pool temperature will be depending upon the room temperature also. So it doesn't mean that your temperature shows that it's 35 degrees and the water will be very hot. It's not like that. It depends on the room temperature also. So we have to maintain this room temperature also. So energy loss has to be calculated. So these are all the disadvantages we face. I'll let you know. Then cardiovascular training and aerobics training should be performed in water temperature between 26 degrees to 28 degrees. As I told, no, it's 26 degrees. Athletes, we can come down till 23 degrees also. So what all the things can be performed? Similar with land-based exercise, except for its mechanic or kinematics. Anything is possible. Lower strengthening exercise can be performed completely non-weight bearing in open chain or complete weight bearing in closed chain. Whatever is there, it's possible. Water provide additional resistance to the body core. Weight bearing can be increased by reducing the depth or by increasing by water belts, weight belts. So this itself might have given a conclusion that what all things is possible and how we can proceed inside the water for various activities. So by constructing a pool or by renting a pool, if we have a little bit knowledge of what the pool depth, what the temperature, and which joint we are going to activate, it gives a super result, super outcome will be expected within no time. Okay, this just small example. What is the pool and how it has to be built? Okay, I'll tell what is the things. Okay, so what all things required? First thing is cervical collar. So cervical collar is required because neck plays a major role in maintaining your metacentric effect. So neck position has to be, head position has to be maintained because it gives more fear. If you're drowned inside, if your face is immersed inside, you will be feared to be inside the water. Then floating rings, pediatrics, we start with the floating rings, and even to the adults in early stages, we start with the floating rings, and to produce resistance, to increase the load or to decrease the load, we get floating rings. Positioning, relaxation, movements, everything, anything can be possible. It's all like it's a skill what a therapist has, and what are the things you want to achieve. It's like it doesn't mean that this thing is in theory, this is only possible. It's not like that. It depends upon the source, what you have. All the sources we don't get in India, mainly after this many years, nearly after 2.5 years, 3 years of my own pool, still I experience some difficulty in this purchasing these special equipments. Then buoyancy belt, this we can buy like jackets, belts, everything is possible, everything is available in the market too. It depends which one you want and what size you need also. Then dumbbells, bars, noodles, gloves, hand pedals, this all like it gives a resistance training as well as core activities as well as balance training. This all things helps to do all these activities. So this is all available in the market. So these all things is basic requirements we need. Hydrotone belts, boots, kick boards, ergo cycle. It's mainly for an fitness ergo cycle, and underwater treadmills, underwater running equipment. So many things are there. So it's all depend upon how we sophisticate ourselves. Then we have aqua noodles also. It's like an thin tube-like things that's called aqua noodles. I had a okay. I'll show later. Okay. So what are things we have to see while getting inside the water? First thing is fear. Everybody has a fear in getting inside the water. So that has to be oriented. That education has to be given. So how we have to give education to the patient? We have to give a constant time. We have to take ample time to get oriented, to adjust with the temperature, to adjust with the depth, to adjust with the environment. So that patience we have to have to our patients. Otherwise it's very difficult, because once they are afraid, they will not come inside. So that has to be maintained in such a way that the patients are more comfort. Once we get that comfort, the patient will not leave that, because that is the most comfort position they feel, and that's the most easiest position they feel. Only thing is the fear of water has to be taken out. There are more techniques to be done, and in practical and demonstration also what all things has to be done. Okay. So neurological disorders, mainly seizures or any for example psychiatric patients or any mood variation patients, that has to be taken in much precaution, much conditioned. It has to be taken, because it spoil your total therapeutic sessions. cardiac dysfunctions also, angina, abnormal blood pressure, high blood pressure patients also, we may or may not be knowing that patients we cannot give an cardiovascular training, or we cannot give aerobic conditioning. So that has to be very clearly prescribed, and according to that we have to change our treatment protocol. If for example patient comes with an CABG or an open or an angioplasty, it has to be calculated in such a way that how we are going to perform our activity and what pace we are going to perform, and what is the resting heart rate, what is the targeted heart rate, how much we achieve, and what intensity workout, everything has to be calculated, and then only we have to make the patients to be we have to perform our treatment. Then wounds and lines, and this plays a major role, because infection and maintaining a pool is very much difficult thing, and we face every day, because easily the infection can spread to the other patients also, other persons also. So wounds, cut injuries, bleedings, and any lines, for example, no, there are some times where we take the patients with the Ryle's tubes also. So that all things has to be monitored, and good precautions has to be taken. For example, if a GBS person comes, we have to facilitate. He will be in Ryle's tube or with other IV lines. So with that, even with that also, we can put the patient inside the water, but with some lot of precautions is to be done. Contraindications: seizures, incipient cardiac failure, unstable angina, respiratory dysfunction, vital capacity less than 1 liter, severe peripheral vascular diseases, danger of bleeding, hemorrhage, severe kidney disease, open wounds, colostomy, skin infection, such as so many things has to be calculated, so many things has to be taken and charges, and it has to be monitored. Main thing is it has to be monitored every day. We may think that this patient we have put yesterday, and whether it's possible to take the patient inside the pool today, but it's not like that. Every day it has to be monitored. Every day his vitals has to be checked. Every day his skin condition has to be evaluated. Then only he can make the patient to get inside the water. So these are the basic things which he has to consider. Then what are the indications? Indications, there is no such indications. Everything is indicated. What all things you want to do, it's indicated. What all things you have to achieve, it's indicated. What all things you have to perform, it's indicated. So there is no indication as it is. These are only the indications. Everything is possible inside the water. So these are the pool design. What all the sizes the pool can be, and the ideal pool is this rectangular or oval. So these are the two things which is very ideal, and that rectangular pool is more ideal than the oval pool, because it is a very good space for us, very good support than the other sizes. So usually many places we have a rectangular pool, and in this, one side we can get down, one side we can climb up, and the water level has to be shallow to depth, and the input, that is how we get inside, it should be towards the shallow. For example, you take this side, is where my marker is there, you take, this is the shallow side. So your stepper should be in the shallow side, so that patient get inside, and this side here he can come out also, or this side should be empty, because no, this side he get inside the water. So shallow side the patient has to get inside. The deeper side, it's not, it's most of the time it is contraindicated. As soon as you get the patient inside the deeper side, the fear will be very high, and you will not get the confidence of the patient, the orientation will be disturbed. So make the patient to get inside the shallow side. And we may think that for a therapeutic pool, whether the stepper what you have in a regular swimming pool is applicable. No, many times I say that 95% it is not applicable, because no, every time we cannot climb or climb up, climb down or climb up like that with that type of ladders. We have to have an ordinary stepper, or we have to build a constructed steps, so that our patients don't get any miscalculation of the water or misdepth calculation. So better, if you plan for a therapeutic pool, it has to be designed mainly as a therapeutic pool, not as an ordinary swimming pool. The rails has to be maintained on all the force, at least on the two sides. The rails has to be there. Patient seating place has to be given. Patient has to get inside the shallow side, and the depth we can vary, because no ideal depth we can make it from 2.5 to 5. And mainly thing, many corporation level, they don't allow more than 5 feet, I suppose. In my place, they don't allow more than 5 feet if you want to go exactly for the licensing of a pool. So we start with the 2.5 till 5 feet. For therapeutic intervention, 2.5 to 5 is sufficient, I hope so. And the length and depth, the length and the size of the pool depends upon what the area you have. We can make it to 10 by 10. We can, if you want to have a single pool for a, sorry, you want to treat a pool with a single person, 10 by 8 and 10 by 10 is sufficient. And but in that you cannot vary the level of the water, because no, it will be ideal level only. Within such distance you cannot increase or decrease the level of the water. At least you should need 20 degrees, 20 feet length to vary the level of the water, because no, every 5 feet, one feet depth can be varied. More than that, it's not able to vary, because otherwise it became very steep. Patient feel difficult inside the water, and the pressure also varies drastically, so it's not applicable. So how much length you have, that much variations you can give in the depth. So how much shorter, that is very difficult for you to vary the length. So and the depth also, no, how much depth you are going to build, it depends upon the level, depend upon where you build the pool, how much space you have. So for a therapeutic interventions, the depth is sufficient to have ideal depth of 4 to 4.5. That is very ideal to our South Asian conditions. uh, it sometimes will be fishy, because no, what will do in a pediatric, what will do in adult who has around 6 feet tall, it's very difficult only. But we have to adjust with our techniques only. So no other options we have, because no, bigger pool building is very difficult and maintaining is very difficult. Okay, so this is the thing. And to build a pool, for example, if you have a land, and if you want to build a pool of as my size, 20 by 22 into 13 or 12 and off, it approximately costs for at least 7 lakhs rupees. It's a minimum cost, I'm telling, because all the four sides should be concreted, and the deck space should be given, and filtering equipments, sand filter equipments are more economic, and it works very drastic, very good. And so we had to go for a sand filter equipments, and the piping, lining, and heater is the main thing. Heater costs around, my heater, it's a heat pump. What I have is a heater pump. It works opposite to AC sucks hot air and leave cold air. In my what is that, heat pump works in the ulta way. It sucks the cold water out and give a hot water inside. And it's cost around, nearly for me it's around 4.5 lakhs, the heater alone. It's for my pool is 45,000 liters. To heat that pool, I got a 6 kV heat pump. It costs around 3.5 lakhs. And building, construction, everything together, to my size of pool, you need at least 10 lakhs rupees for that. I'm telling of minimum cost, because it's in first floor for me. I built the pool from the day the building rises, and to convert a old building, it may cost higher. Nowadays ready-made pools are also available, that also will come close to this. But for that space, everything, it's like what we have, how much space we have, what can be done. So it has to be calculated, or it has to be planned early. If you want to construct a therapeutic pool, better to go with the building. If you have a space, go with the building the day one itself. So it goes like that. And there should be like a skimmer. I'll show my diagram. So these are my input pipes, where the water comes from. Here, this side I have my filtration unit. I have a separate room. From there the water comes inside, and this is my heater pump hole. The heat water comes this side, and this is the skimmer I have. I have some other skimmer the sides down also. So the water goes out like this. And what happened is, like, during my construction there was a fault. The deck space, we didn't, my engineer didn't calculate. So I made this stepper on the deeper side only, because it's not possible for me to keep it in this side. previously I had this side, but it's very difficult for the person, for the wheelchair to come and get inside this crane for the shifting. So I keep in this, but it's a contraindicator only, but no other option I have. So I mostly I take the person through this manual operated sitting crane only. We just make the patient sit and we put it inside. So these all the drawbacks I suffered. And if anyone has this idea of creating a pool, you consider these things, or give me a call without any hesitation. From the day one, what has to be done, I'll tell you how it has to be taken place. Okay, these are the lines where it has to be given. So these all things swimming pool designer will be taking place, and there are so many consultants, swimming pool consultants are available everywhere. And the consultant should come to your place before you plan, or you have to plan a pool with the consultant only. Without, after building, don't consult the consultant, because no, you have to, once again you have to put holes inside. Once you have to crack your building, or once you have to crack your all the walls. So it's always highly dangerous. One single crack may cost you immeasurable cost. We don't know where it leaks. So it's a very highly painful thing. And it's very tough thing to tolerate. If you have a leak in the pool, it's very difficult to stop also. So these things are very, very important. And to maintain the hygiene, I have a granules. So chemical granules I have. It long lasts for 8 hours. And the calculation of the granules, how much has to be put inside, and how often you have to put, and it will be calculated by your swimming pool consultant. How much we use, that much cleaning you have to do. And filtration unit, it's a closed filtration unit. It's very, very important. And you cannot, and that every time I'll drain my pool and I can give a new water. It's not possible. It's not so easy, because for me, this 45,000 liters, it takes 3 days to be filled. It takes that much time. My motor has to pump from the bore, and it takes 3 days to be filled. So it's not easy that every day we can drain and every day we can pump in the new water. It's not possible. Better to go for an recycling unit. And for me, it takes 6 hours per day to recycle my 45,000 liters of water. It has to run. Whether you are using your pool or not using your pool, it has to run for 6 hours. Otherwise, your hygiene will be in a question mark, because every day you put the different type of patient. We don't know if the kids are there. They may void, they may urinate, and they may spit. Whatever is there, it has to be cleaned. So every nook and corner of your water has to be recycled. So again, it's all like how much space, how much water, and how much depth, and what is the length. It all varies accordingly. So these are the design and construction of the pool. So I hope so. The time is up, what was given to me. I think we'll
Yes.
stop here.
Over to you, Dr. Priyanka.
Yeah. Okay. Any questions or anything, you can come to me.
So one question was there from Dr. Shivani. What if
Yeah.
patient is hydrophobic? As you have told that there's an orientation program, but this was her
Yeah.
question.
Yeah, that's what. No, we have to, first of all, we have to give a confidence. How we have to give a confidence is take the patient in with the very, very shallow water depth. For example, below the knee level, slowly increase the depth of the water. Slowly make them patient inside the water. Give breathing exercises, touch, feel everything he has to be given to the patient slowly. Then maybe after 2, 3, 4, 5 sessions only, we can make the patient inside.
Thank you so much, Dr. M. Theepak, sir, for this
There is another
wonderful
question,
session.
Priyanka. There's one more
Okay.
question.
Yeah.
Ask.
Yeah, it is from Nigel Gonzalez. Any added advantage in blood glucose control for diabetic individuals as compared to other exercise therapy regimens?
Yeah, sure, sure. It is there, no, because no. See, for example, again, we pay it's a heart rate. Mainly, we talk about the heart rate, and see, if for a diabetic patient, no, early stages, if you increase the heart rate of the patient, the glucose level increases, as we know. After one stage only, the glucose level comes down. So that what happens is here in water, how much resistance we give, how we added value to your particular activity, the variations are there, very drastic variations you get in your glucose level. That's what it means. For example, if you increase the intensity very high, or if you make the patient go for a for example in land set, the patient walks for 15 minutes and his respiratory level and his heart rate maintains for example 120, you have like that. In water, to that maintaining of 120, how much effort we produce, how much muscle work is produced is totally variant from the landscape. So there is a total variation in glucose level too in land and water.
Okay, sir. Thank you so much, sir. That was a
Uh,
wonderful session. Yeah, Priyanka.
Thank you to all participants as well. We are very grateful to all seniors and CC members for guiding us and supporting us, especially Dr. Ruchi Vaishnav ma'am, our National Head Women's Cell, and Dr. Sanjeev Jha sir, our IAP President. Last but not the least, thank you, Dr. Neha Singh from IAP India Technical Team. Kindly subscribe to our IAP YouTube channel. Thank you.
Thank you so much, sir, for being here.
Thank you.